This is Crystal Fenn with MedPage Today, reporting from the American Stroke Association's International Stroke Conference in San Diego, where researchers presented evidence supporting telephone consultation as a way to increase use of thrombolytic therapy for acute stroke at community hospitals. Dr. William Meurer from the University of Michigan described the telephone hotline available to hospitals through the study at a press conference here.
We give them our phone number that they can call the University of Michigan stroke team at any time of day, any day of the week, any day of the year. And we, at the University of Michigan, have been taking care to sort of track what people have been calling us and asking about with respect to these acute stroke cases. So we reviewed our call log for approximately 1 year period to sort of classify the patterns of questions that were being asked and what ultimately happened to the patients in whom they sought our advice.
The researchers found a significant effect on appropriate use of tissue plasminogen activator therapy for acute stroke at these centers.
We found that the impact of our recommendation, if we said yes, I think you should treat this patient, versus we said, well, maybe, it depends on this, or it depends on this. The association of our recommendation with ultimately getting treated was fairly strong, an odds ratio of 4. So if we said yes, the odds of getting treated were about 4 times than if we had said maybe. That could be somewhat in part due to the fact that more complete information was presented to us at that time. However, it's a pretty simple thing that we did. We provided them with data and recommendations regarding the current AHA guidelines for the acute management of acute ischemic stroke. So I think we were doing a good service for these folks, and it was really not particularly burdensome on our team. And in the patients who were treated thus far, we found that we observed a symptomatic ICH rate of only 4.7%, which is in line with what has been seen in the trials. So we found that this was a very feasible system. It was very easy to implement. It only involved us basically having pagers and telephones, and also the hospitals having telephones, which, I did say there are parts of Michigan that are remote, but we all have telephones, so it's not that bad.
So access to a telephone hotline for stroke expert consultation may help improve TPA use rates at rural and other community hospitals. I'm Crystal Fenn, MedPage Today.